Okay guys, today we're diving into something that might surprise you, how a common heart medication could be messing with your sleep and causing weird, vivid nightmares. I'm talking about Metoprolol, a beta blocker that millions of people take for high blood pressure, heart rhythm problems, or heart failure. If you've ever noticed your dreams getting extra intense, scary, or just plain strange after starting a new heart med, stick around because we're breaking down why it happens, what's actually going on in your brain, and what you can do about it, all based on real science. Let's get straight into it, guys. All I ask from you is just to hit the like button down below. It tells YouTube this is worth showing to more people, so if you like learning about health from a scientific perspective in a calm and collected way, consider subscribing too. First, let's start with what Metoprolol is, which, by the way, 59.5 million prescriptions were filled for Metoprolol in 2023, which goes to show a lot of people are taking this one, but might not know exactly what it is. Metoprolol is a beta blocker used for chest pain, heart failure, and a heart attack, high blood pressure, and an abnormally high heart rate. That means it works by blocking beta adrenergic receptors, which are part of your sympathetic nervous system, basically your body's fight or flight system. By slowing your heart rate, relaxing blood vessels, and lowering blood pressure, Metoprolol makes your heart work more efficiently and reduces strain. This is why it's so widely prescribed. It's also used to prevent migraine headaches and off-label use for thyroid storms. Here's something important to know. Metoprolol is lipophilic, which means it dissolves in fat and can cross the blood-brain barrier. This is huge because it explains why it can affect your central nervous system, including your sleep cycles and dreams. Lipophilic beta blockers like Metoprolol can reach your brain and alter neurotransmitter activity, specifically reducing norepinephrine, which is involved in regulating sleep and mood. That subtle shift in brain chemistry is thought to be the main reason some people experience vivid, fragmented, or even nightmarish dreams while on this. Some of the other beta blockers in this family also cause weird and scary dreams, propranolol being an infamous one. That can have you experiencing beyond bizarre dreams with that. And here's the science behind it. Beta blockers affect your sleep architecture, especially REM sleep, the stage where most dreaming occurs. By altering norepinephrine signaling in the brain, Metoprolol can disrupt normal REM cycles, making your dreams feel more intense or bizarre. Studies estimate that 10 to 15% of people on beta blockers report vivid dreams or nightmares, which is not uncommon at all. And it's not just occasional weird dreams. Some people experience them almost every night for months. I can't imagine going from not remembering your dreams to experiencing nightmares every night. And the crazy part is, guys, that you can develop daytime sleepiness because you wake up from your sleep and at night and not get quality sleep as a result. Other things you have to watch out for are swelling of the hands or feet, fatigue, shortness of breath, and if you experience any of those, let your healthcare provider know too. It's not just about the nightmares that you could get. But as far as the dreams, Metoprolol, especially the long-acting forms, tends to linger in your system overnight, coinciding with peak REM sleep and amplifying the effect on your dreams. So what you could do if you're experiencing nightmares on Metoprolol, first, don't stop your medication on your own. Beta blockers are critical for protecting your heart, and stopping suddenly can be dangerous. Always talk to your doctor first. Here are some strategies you could discuss with them that I think are super effective. First, time the adjustments. Sometimes taking Metoprolol in the morning instead of the evening reduces nighttime side effects because less drug is circulating during your peak REM sleep. Second, dose adjustments. Lowering the dose under medical supervision can reduce the intensity or frequency of nightmares. Third is seeing if you could switch beta blockers. Not all beta blockers are equally lipophilic. Hydrophilic ones like atenolol don't cross the blood-brain barrier as easily and are less likely to affect your dreams. Your doctor might suggest switching to one of these options. And fourth is just to improve your sleep hygiene overall, guys. Keep your sleep environment cool, dark, and quiet. Avoid caffeine or alcohol close to bedtime, and stick to a consistent sleep schedule. While this won't completely prevent Metoprolol-induced nightmares, it can reduce overall sleep disruption and help you feel more rested when you wake up. And just to be thorough, let's cover the rare but serious side effects too. Beta blockers, including metoprolol, can occasionally cause severe bradycardia, which is a slow heart rate, hypotension, worsening asthma or COPD symptoms. These aren't nightmares in your sleep, they're actually heart or lung emergencies. So it's critical to monitor your symptoms and call your doctor if you notice dizziness, fainting, or trouble breathing. And I just remembered, one more really important thing you should know, especially if you have diabetes: metoprolol can actually mask the warning signs of low blood sugar. Normally when your blood sugar drops, your body gives you red flags like a fast heartbeat, shakiness, or anxiety. But because beta blockers blunt all of that adrenaline, that rapid pulse warning can be hidden, which makes hypoglycemia harder to recognize. So you're gonna have to rely more on actual glucose checks, especially if you're on insulin. So here's the takeaway, guys. Metoprolol is a fantastic med for your heart, but because it's lipophilic and crosses the blood-brain barrier, it can sometimes alter REM sleep and cause vivid or disturbing dreams. If it's happening to you, strategies like adjusting the timing, switching beta blockers, and practicing good sleep hygiene can help. If you learned something new today, subscribe to the channel, hit that like button because it tells me you want more videos breaking down the science behind common medications, and drop any questions or experiences in the comments. I read them all and love helping you make sense of these side effects. Take care of your heart, pay attention to your sleep, and I'll see you guys in the next one.